I'm Dr. Ujjwala, mentor at Study Medic. Welcome to our YouTube series on EFOG Part 2 OSCE preparation. And today we are dealing with a difficult patient. So let's start. And my role player is Dr. Priyadarshan. So let's start the scenario. You are a Stephen registered in a breast surgery clinic. You are seeing Mrs. Sara Malik, a 42-year-old patient who underwent breast conserving surgery for triple negative breast cancer 2 weeks ago. You are here to explain her histopathology, which shows the positive margin, counsel her about further treatment options, deal with her emotions and potential anger or distress, maintain professionalism and clarity throughout. So let's start the scenario. Is this Mrs. Sara Malik? I'm Dr. Ujjwala, one of the doctor covering here. How would you like me to address you?
You can call me Sarah, doctor. Well, I've come here to deal
And
with some serious talks today.
you are aware of your report, Sara?
I saw them. It states it is positive. I know something is wrong in this hospital.
Sarah, let me confirm. Let me summarize what happened actually. The report which we had. Can you take me to the event that lead to have the surgery, and in your own words?
See, I had something in my breast. I had to come. I had to do a surgery. The doctors did tell me that, okay, things are fine. You get a surgery and everything will be okay. So I trusted. I trusted your hospital. That's why I came here. I had my surgery. And today I'm looking at the report and it's positive. What do you mean? You have left back my cancer cells.
What did they, Sarah? Thank you for explaining that. But what had understood about the surgery and the result? Did they explain you anything prior to your surgery?
No, yeah, they told me that after the surgery, everything will be fine. I will be off cancer.
I understand you had trusted that the whole cancer would be cured of. And after hearing this, this must be a very difficult. I understand. But sometimes, Sarah, it's very difficult to assess during the surgery. The margins cannot be assessed during the surgery. That's why we always take the report and we always wait for the final report to come to take the further step.
Yeah, doctor, I understand all that, but what has happened in my case? Don't you think that your
What
colleagues are
happened?
at fault?
Sarah, actually, I told you your surgery went well. The tumor was removed as we decided. But however, the report shows there are the few cancer cells remain at the age where the tissue has been removed, which is called as a positive margin. So it's very, that doesn't mean this report that your cancer has spread to some other part of the body, but it does mean that the cancer has, we need to further treatment to remove those cancer cells which have left. And there are options available. Do you want me to discuss with that? What are the options available to you?
Yeah, tell me, doctor, tell me. I want to know what's going to happen with me next. I'm really upset with all of y'all.
I understand. I understand your concern. This is quite upsetting that knowing all this, like you were not expecting, and suddenly it comes out positive margin. That's really understandable. Coming to your options, there are the first option is re-excision. That means a second small surgery to remove those
Oh my
cancer cells
God,
at the
you
age.
think I have to do one more surgery with y'all? No, I don't have the trust at all, doctor, with y'all.
Other option what we have is the mastectomy, that is removal of the whole breast. Well, if like that will be suggest if the second operation not able, that is a small surgery not able to remove the cancer cell, or if you prefer to remove the whole breast to be safer, that could be the another option. And further treatment would be by radiotherapy and chemotherapy to kill the remaining cancer cells. Sarah,
No, doctor.
do
All I
you want me?
understand is you're just trying to cover up for all that your colleagues have done. I feel that your colleagues have done some grave mistake and you're just here to try and explain me and to convince me.
Uh, Sarah, let me tell you, routinely. When there is any tumor or any suspicious mass, we always take the biopsy from that area and we send it for the histopathology report. Till that time, we will not, we wait for the report to come to make it the final. So it is the same routine what has been done with you, Sarah. But I
Now,
want
what
to know,
next,
do you
doctor? What next? What should I
have
do?
a yes? So now I just want to ask a few history for a personal or the family history to just to get a better idea. Do you have any any medical condition?
Yes, doctor, all that has been explained before my surgery itself. Now, why should I talk about
Any,
that once again?
okay, any family history of cancer?
Yeah, of course, I do have a family history of cancer, and that's why I'm so much worried.
I'm sorry to hear that, but thank you for letting me know because this will help in planning your surgery, your further plan. So, if you have a cancer as a family, then we might go for the genetic testing also. That would also be recommended for you. So, along with your
I just
options
want
like
to
your have
understand that, I don't want that, this, and so many things happening with me. Now that the cancer cells are left behind in my body, does it mean that I'm going to die very soon? Is this because of your negligence?
no, Sarah, that doesn't mean that you will die very soon. As I told you, the cancer has not spread to other and the cancer has not spread to any other part. It is just the localized. We need to take out with further surgery. Either could be the reexcision could be the mastectomy. But the team of the we are not alone in this journey. We as a team, like including my breast surgery nurse, surgical team, we all are there at every step to guide you. And your wishes will also be considered. You will be involved in the treatment, what we are giving you. The treatment would be decided by the group of a doctors, the multidisciplinary team we call, then we take the final decision, but your decision and wishes would be taken into consideration to make a final decision. Am I clear so far? I
Yes,
understand.
doctor. Yeah, I do understand. I want to meet your consultant and I want to discuss further, doctor. I'm not interested in, coming to this hospital anymore.
So I know a lot of things to take in. So today I'll be connecting you to my counselor that will help you to cope and help you to take the decision. How does that sound?
Yeah, I will talk to them. I do not trust any one of y'all, and probably I will just talk to the consultant of what all the doctors have done to me.
Or I'll be making an appointment with my consultant also. And this
Thank
is
you
the
for that.
written patient information leaflet. You can go through it. And how you are getting home today?
That I will take care of, doctor. I have my family, they can take care of me.
Okay, till that time, till someone comes, my nurse will be there with you. Thank you for understanding.
Thank you. So yes, so well done, Dr. Ujjwala. This was a good station, I should say. And dealing with a difficult patient is again one of the tricky stations that we can see in EBCOG Part 2 examinations, and you did a fairly good job. And again, here the role player and the examiner, both of them will be giving marks. The role player is going to see how professional you were behaving, whether you were trying to blame the colleague, whether you were letting the role player to pour out all the emotions, and whether you were validating and acknowledging them. These are the key factors that the role player is going to look. And from the examiner point of view, they are going to actually see how safe a doctor you are, how good a doctor you are, whenever there's actually a clinical conflict that is coming up. And also the information, whatever you're giving to the role player, has to be very, very crisp, and you did a good job on that. Thank you.
Thank you. Thank you.